This episode of Ask the Doctors is being made possible through the support of Wayne County government and the City of Richmond.
From the Richmond Code Enforcement Department.
On behalf of the Richmond Police Department.
On behalf of the Richmond Street Department.
From everyone at Roseview Transit.
From the Finance Department.
From the Office of Human Resources.
From the Richmond Sanitary District.
From the Parks and Recreation Department.
From the Law Department.
And the Information Technology Department.
From the Department of Infrastructure and Development, City Planning, and the Richmond Municipal Airport.
On behalf of everyone from the Richmond Fire Department.
From all of us here at the City of Richmond to you and your family, we wish you a very Merry Christmas and a happy and safe New Year. Stay strong, Richmond.
Your friends in Wayne County government hope you have a happy and safe holiday. They hope you will keep your gatherings to immediate household members. But whatever you choose to do, please follow all local public health guidelines, including proper hand washing, social distancing, and minimally wear your mask. A box of 50 masks will be available at a drive-through mask giveaway in Glen Miller Park on Saturday, December 19th from noon to 3 p.m. Enter the park at the main entrance next to the Madonna of the Trail or on Elks Road.
Good afternoon and welcome to this edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, and streaming on Facebook Live. My name is Eric Marsh. I'm Executive Director of Whitewater Community Television, and it is once again my honor to host this program with two gentlemen who have given up, 38, 39? I think you keep count.
We've got to be 40 by now.
We count on Tom to keep the tally.
Oh, I need to go back and figure that out.
A whole lot of weeks of this, and these gentlemen have given up their time on a weekly basis. Dr. David Jetmore, who is Wayne County Health Officer, Dr. Thomas Huth, Vice President of Medical Affairs at Reed Health, and both of them newly vaccinated. So we're going to talk about that. You all had a chance to get the first vaccine shots here in Wayne County.
Yeah.
Even before we figure out the past week, that's the big news. So, first of all, did it hurt?
Yeah, it always hurts to get a shot, but I was telling Tom earlier, you know, our lives are a series of shots. When you're a little boy, your mother takes you to the doctor, and the feeling is one of trepidation and fear. Then as an adult, you've got to get some vaccinations, and it's need to have this. It's a feeling of resignation. That last night was a group of people waiting to get a shot, and the atmosphere was festive.
Yes,
we were so happy to get our shots and to have this nightmare begin to come to an end. So it was great. And then I waited to get all these supposed side effects, but I feel great. My shoulder's a little sore, but whenever I feel that, it reminds me that I've been vaccinated against COVID.
Okay.
So it cheers me up.
1 out of 2. Side effects from you, anything you're feeling?
I told Dave when we came in here, I feel perfectly normal in every way. If I think about it, I can, yeah, there might be a little something in my arm, but that's a disappointment to me that I feel perfectly normal, because I wanted to have more of these side effects that we've been hyping. As you know, we've been saying, now you will have side effects, that everybody does, but for us, and I did a little spot poll with everybody that was there last night, the 4 doctors who got vaccinated, and virtually everybody feels the same way. So maybe these supposed short-term side effects of feeling poorly for a day or two are not so bad as we've been led to believe. Now that's not a very scientific study. It's 4 people, but you know, I think that's a great start.
You all were vaccinating more people today. How is that actually working?
Right when I came over here, I was told that we have done so far 130 people today, and there are about another 50 slated to come through on today's schedule. And that's what we'll be doing every full day from here on out. Tomorrow will be a half day, and then Sunday's off. But next week we'll be doing full days, except for Christmas Eve and Christmas Day.
Okay. Talk a little bit about what this week has been like for both of you all. One, obviously leading up to this, it's taken a lot to get from where we were hearing about them to the point where they actually arrived, to the point where they got thawed and put in your arm, but also from both of you, where are we in Wayne County as we stand on this Friday?
Well, we're right on the very front lip of the whole thing. I mean, I think from here, you know, what we're trying to do is vaccinate the highest risk healthcare workers. And these are people who work on their front lines, confront COVID personally every day with patients and so forth. And we're trying to get to also the staff who work in long-term care facilities, because basically by vaccinating them, we'll begin to erect a wall of defense around the residents of those facilities. I don't know as we sit here how many have been able to get in so far, but I did, as soon as I got the link, I did disperse that out, and I asked the health departments to help disperse that information, so hopefully they're taking advantage of it. But, you know, that's the very, very first kind of, you know, shot at the cannon, and we only have about 1,000 doses to do that with. So really the rest of it from here hinges on the state getting us a lot more vaccine. And then internally, we're looking at how can we ramp up our capabilities to get more healthcare and healthcare-affiliated folks like EMS and so forth, school nurses and such like, vaccinated as quickly as we possibly can. I think we have kind of a window of opportunity with a lull in Reed's numbers that we can divert some resources to making that happen. It's just a matter of getting people to come in and take advantage of it. But for the community, later on, it's really more about how quickly can the federal government, the vaccine makers, and the state government get this supply pipeline fully wide open and take advantage of all the vaccinating capability that we're working on, that the health departments are working on, and then we can do mass vaccinations. And I won't rest completely until that is well underway.
From the health department standpoint, you all will begin vaccinating some people in early January. Is that correct?
I believe so. One of the problems we have right now is we recently got a grant to pay for more vaccinators, but it's hard to find those people right now. We'll find them, but they have to meet certain qualifications to be vaccinators, and that's a smaller pool than you might think. But we'll solve that problem, Eric.
Okay. The federal government, the CDC, I think has laid out some guidelines as to who goes in what order. Have they carried that all the way through, or is there just Pod A gets this and they're still trying to figure it out from there?
No, I mean, I think they have I would say the plan is still fairly broadly outlined. It's not down to extremely specific granular level, but it winds up in phase 3 for general public immunization. What we don't have are real good timelines around when all those phases are expected to be implemented. The early phases, yes, we're doing phase 1A now, and what I was told is that the health departments have been told to have their phase 1B vaccination sites ready to go by January the 11th, is what I heard this morning. That was actually pushed back a week.
Okay.
But all of the smaller county health departments are having the same issue that Dr. Jetmore just referred to is how do you find the staff? They have plans on paper, everybody got plans on paper, but you have to be able to staff into that, and that's a challenge for small counties with limited resources, and both in the form of ability to pay for those resources, but also where do you find them? They're not that's a kind of, it's a relatively scarce skill. But we do have some definition of timelines around the very earliest phase. The rest of it just depends on when vaccine can be made available and all of the systems can be set up. But I think what I last saw was that the federal government, the FDA and the federal government, Operation Warp Speed particularly, are expecting about 100 million doses to be available, to have been supplied by about March to April timeframe. And of course that's a third, that would cover a third of the population. Mm-hmm. We need to get to 2/3 of the population to really be comfortable that we're getting into the herd immunity range. So there will be a lot more work to be done behind that. But I think they're hesitant to try to put some time frames beyond that because it really does depend on a lot of factors that are complicated in their interactions, and we don't know yet how they're going to work out. But I think the hope is, I'm hoping, that we'll have the ability to vaccinate virtually anybody and everybody who wants it by next summer.
Last thing before we go to our guest, and we do have a guest joining us on Zoom. Last week this time we were sitting here waiting on the emergency use authorization for the Pfizer vaccine, which is what you all have. I think we're still sitting here waiting on the emergency use authorization for the Moderna vaccine.
I
didn't hear that come
imminently. I stopped looking at the news about an hour ago, so if it's coming in the last hour, I don't know about it, but we are expecting that today. They were saying that they thought that would be turned around more quickly than the Pfizer EUA was, and I think that kind of plays into something I feel like I've noticed in kind of looking at the information that's available on Moderna and Pfizer. They're actually really similar, so I don't think that there really is a lot that's specifically unusual about the Moderna vaccine that will cause slowdowns in that. But yes, I think every expectation is we'll have the Moderna EUA today. I'll be looking for that tonight, this evening, because I have I'll be doing some discussion of all of this with some different media outlets between tonight and tomorrow. But I'm expecting it to look very, very similar in terms of the limitations of use and so forth.
I don't think it's a secret. I don't think it's anything we can't tell. I think you're expected to be on MSNBC tomorrow morning.
I will be doing a live interview.
In the 7:30 or so range?
Yes, I will be doing a live interview with the weekend anchors at MSNBC. Right now they're telling me expected to be around 7:40, but all that is approximate. I will be ready to go from 7:20 on, and it could be probably anywhere from there up to 8 o'clock probably. And so we have to be flexible, and then it depends on what other news they're going to be getting into. Certainly the Moderna EUA will have been out. But their focus, I think, is an interesting one. They've gotten very interested on the impact of COVID-19 in the rural parts of America, where a lot of the focus has been on the urban centers and the more populous states. And so they've been interested to talk to us several times, but I'll be doing that live, basically stand-up question and answer thing with the anchors at 7:40-ish, if anybody cares to listen to that. I'll also be doing a special touch base with Channel 7, WHIO Dayton, tonight at 5 o'clock. I'm not normally there on Friday, but they wanted to talk to me post-vaccination, and I'm going to have to sadly report to them I feel just fine. So, that doesn't necessarily make for great news, I guess, in terms of, because news is about what's exciting and different and horrible. And they're sort of, I think that from their standpoint, it'd be better if my arm was falling off when I was half dead. But that isn't going to happen. So we'll have to see how this works out.
Okay. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook. We will be taking your questions for the doctor. So if you want to provide us those questions, you can do it on our Facebook page, or you can send us a question via Twitter at WCTV Info. Just so you can practice your stand-up, I'll let you introduce our guest.
Sure, I'd love to. Hopefully Billy's there. There's Billy. I hope you can hear us, Billy. Hope we can hear you. Oh, sounds like we've got a good connection.
There you go. Love it when it works.
Yeah, it's great. It's great when it works. This is Billy Kester. Billy is a colleague of mine at the hospital. She's the vice president for Continuum of Care, which kind of is a nice, concise way of saying she has probably one of the broadest footprints of responsibility in the place. She is responsible for a lot of inpatient and outpatient-based hospital stuff, but also is probably most directly running our physician network here today. And I've done that before. I know that's holding a tiger by the tail. So she deserves a saintly crown of some sort. But Billy is here today because she is, most importantly, a COVID recovered survivor and had a very interesting course. So I thought it would be fun to hear from Billy about her experience with COVID-19, both the acute illness, how long that lasted, what were the effects, but also she had an interesting sort of post-COVID course, which to me is a kind of an important lesson that we think about COVID-19 being this short-lived upper respiratory illness and you go about your business and you're fine, which may be true for a lot of people, but it was not for Billy. So tell us about it, Billy.
Sure, I'm happy to share my experience. I contracted COVID in late March and similar to everyone, thought that this was going to be a 14-day course because that is what the CDC said. We needed to stay home for 14 days and it was going to magically disappear. Through my COVID course, I was at home and working from home, had many of the symptoms that we hear of, shortness of breath, cough, fever, but I overall didn't feel too bad. I was able to continue working through that. And after my 2-week period, I returned back to work. I was back at work for about 2 weeks, and other than being fatigued and feeling a little run down, was doing fine with that. But after about 2 weeks of being back at work, I started developing a severe stiff neck, and that progressed over 2 days. It was a Thursday when I first noticed that, and then progressed into Friday to the point that by the end of my workday on Friday, I could not turn my head to visibly look for oncoming traffic as I was pulling out of the parking lot. By that time, my head had really started hurting. I had a really bad headache, which with COVID, I had a headache pretty much for that full 2-week period, but this was not a headache like I had ever experienced before. That evening, I went home, pretty much just laid down, tried to rest, thinking that I had strained a muscle, pulled a muscle, and this would go away. As the day turned to night and we progressed into Saturday morning, I was feeling worse. I could not be standing or sitting upright. I had to be laying down or I would be very dizzy, nauseous, vomiting, just in misery. So I did seek treatment thinking that this was a pulled muscle, potentially leading to a migraine. And if I could just relieve that tension, I would be okay. Which, I tried treatment for that. That was unsuccessful. I didn't have any relief. I tried treatment for migraine. That was also unsuccessful. I didn't have any relief. By Monday, I didn't feel like I could go to work. I still could not sit upright or stand without being very dizzy and nauseous and having excruciating pain in my head. So I was actually just laying on my couch. One of our physicians was texting me through the day about our respiratory clinic that we had just set up in March. And I told her I wasn't really able to answer her questions. I didn't feel like I was making sense. So obviously that was concerning to her. She called me right away and got one of our neurologists involved, who scheduled me for a video visit on Tuesday. We chatted briefly on the phone. He determined that he needed to see me in person, so we did a video visit just through FaceTime on the phone, and he determined that I needed to be admitted. I knew when I was talking with Dr. Rayner, our neurologist, that I wasn't answering questions appropriately, but couldn't discern what the appropriate answer was to those questions, which was very concerning to me. I could not come up with simple directions that he was asking me to do. Listening to him and following directions was very difficult for me. So upon my admission to the hospital, I had numerous tests and things, and they did discern that I had a cerebrospinal fluid leak from a tear in my dura, and that was likely due to me coughing with the weight of my laptop bag, my purse, and things on my shoulders as I was walking out to my car. But as a direct result of COVID, that cough for me was lingering beyond that 2-week period, had progressed into, my time returning to work, and was often with exertion or activity. So just walking out to the parking lot, I was coughing pretty significantly on the way out to the parking lot, and this caused this subsequent dural tear that led to the CSF leak and some debilitating pain. That course of treatment for that went on for about 2 months. I had caffeine infusions. I had 3 blood patches trying to repair the leak to get relief. So my couch and I became even more familiar than those who have been staying at home. I was not really able to leave the couch for that period, and frankly didn't know that I was ever going to be able to return to full function again, because my cognition was very impaired and I was aware that it was very impaired. So it was a very, very scary ordeal for me, and certainly not a simple 2-week period of staying at home.
Yeah, you sort of telescoped a lot into there, but it seemed to me, my feeling at the time was that it took a pretty long time to kind of fully work out exactly what the problem was, didn't it? And there's in that period where you're having this very unusual set of symptoms, we had never heard about people with COVID-19 having that. That must have been additionally frightful, not really knowing what the heck was behind all that.
It was scary for me. It was scary knowing that I wasn't able to make sense of things. That's a very frightening thing in itself, but knowing that I felt absolutely helpless. I did not feel like there was anything that I could do to learn about what was happening to me or to get help for myself. It was a very scary experience.
So how long did it take for you to feel like you'd fully recovered, or do you still think that you feel fully recovered?
I'm smiling because when we were working through things in the beginning, Dr. Rayner said it will be 6 months. I'm filling out your paperwork and this will be at least 6 months. And I thought he was crazy. There's no way. I'm healthy. I will bounce back from this much sooner. That 6-month mark was October, and I would say it was the 1st of November before I felt like myself again.
Wow, that's a long time. And what do you think it was that finally kind of made the difference? Just time, or were there specific interventions that you did that you think made the most difference?
Well, in addition to the CSF leak, COVID had apparently wreaked havoc on my thyroid. And so balancing out those thyroid hormones and trying different medications with that actually, I think, was the tail end of the recovery process for me. So now that everything is back in line with my thyroid, I think that has solidified my recovery.
Okay, so a thyroiditis and was on top of all of that. Any other things that were impacts of COVID on you?
I had never had high blood pressure in my life. I was always the person who had low blood pressure. Every time I had gone to the doctor or been checked in, I am now on 3 hypertension medications, which we were hoping that I would get to come off of those, but so far that has not been the case. So I have to carry around a trusty pill holder with me every day so that I have my daily medications in the morning and in the afternoon. Previously, I took 1 pill a day, and I am taking 10 in the morning and 4 in the evening.
Billy, exactly where was your dural tear anatomically?
They could not actually locate it. I did have a CT myelogram, and they were not able to locate the tear, but they did feel that it was likely in the upper thoracic into the cervical region.
Okay. For our viewers who are not totally familiar with medical terminology, the coughing she had was so violent that it caused a tear on a covering surrounding the brain and let fluid leak out, and this caused her headache. So did the tear simply heal on its own, or were they able, did the blood patch work, or?
I had immediate relief after the first blood patch, but within 2 days, I was back to the exact same symptoms. And then we waited 2 weeks. We did another blood patch. I had a little relief after that one, but within 3 days, I was back to the same. Waited another 2 weeks, did another blood patch. That time I didn't really have any relief. We did add theophylline to the treatment, which is thought to increase the body's production of cerebrospinal fluid, and that did help in the end. And really just rest and recovery, laying on the couch.
You've referred to blood patches several times, and maybe it will be helpful to the viewers for you to maybe describe what that process is. What does it intend? What is the theory on that, and exactly how is it carried out from the perspective of somebody who has undergone it?
So a blood patch is done to hopefully seal that tear, and typically it is blood that is withdrawn from you. So they withdraw blood from your arm, and then that blood is then injected back into the spinal column so that it can seal the tear on the dura and hopefully patch that location so you're not losing the cerebrospinal fluid.
So that's done through basically a spinal tap. People probably have some conception of what a spinal tap is, but instead of withdrawing fluid, we're actually injecting blood. It maybe sounds a little barbaric, but I think that procedure kind of originated, way back in the early part of the 20th century because, spinal headaches are not very common, but a significant side effect or consequence of having a spinal tap for other reasons, and so blood patches have been done forever. Typically, blood patches, in my experience, when people have them, because after having had a normal spinal tap, they're like instantaneously effective, and people just go about their business and have no consequence from that. But you underwent, sounds like 3, and it still was kind of incomplete.
Yes.
Wow.
Probably it was because it was so much higher in the spinal column.
Yeah, maybe.
I'm so glad that Dr. Huth asked you to be here, Billy, because I think so many of our viewers picture a COVID patient that has this kind of problems as an elderly woman in a nursing home. And here you are, a young, healthy individual, and it also shows how this disease can affect so many parts of your body, not just your lungs, in your case, your thyroid gland, your blood vessels causing you to have high blood pressure. So I'm doubly glad that I got that vaccine last night, Billy.
Well, speaking of that, Billy, I happen to know that you are trying to pay it forward a little bit. Why don't you describe what you're doing to help other COVID patients?
So as a COVID survivor, you are eligible to donate convalescent plasma, and that is given to patients who are suffering with COVID so that your antibodies from your plasma can be put into their body to help them fight off the effects of COVID and hopefully recover quicker. And if you've had COVID, you can be tested for COVID antibodies and then give convalescent plasma through a plasma donation process and be able to help or potentially save the lives of someone else who's suffering.
Yeah, and I hope that our viewers, some of whom probably are recovered COVID patients, kind of take that to heart. They can help others who are more sick. We use the convalescent plasma typically in people who are sick enough to be in the hospital. You spent a little time in the hospital, but it was really more for these neurologic consequences, and you weren't really in for COVID-19. So in a sense, we tend to think of people having bad COVID problems who've been sick enough to be in the hospital, but this is another way that Billy kind of is, a sign that you can have severe consequences without having been sick enough to be on a ventilator and such like for COVID-19, and our viewers need to keep that in mind.
Billy, we thank you very much for sharing your story with us. Thank you very much for being here. We greatly appreciate the time.
Thank you for having me.
Thank you. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live, and you can send a question if you have it for the doctors, Dr. David Jetmore, Wayne County Health Department, Dr. Thomas Huth, Reed Health. You can put a question on our Facebook page or send a question via Twitter at WCTV Info. This is Ask the Doctors. We've got probably about 25 minutes left to go, so let's see if we can roll through a few of the questions that we've gotten in today. How many flu deaths has Wayne County had, and how many overdose deaths in Wayne County?
Well, it's a two-part question, and I don't know the exact answer to either one. The number of deaths, I think, is at least 113.
From flu?
From COVID.
Okay. The question was flu deaths.
Oh, flu. I'm not aware of any flu deaths in Wayne County. Are you, Tom?
No.
All right, so it's 0 for flu deaths. And I'm not aware of the number of overdose deaths in Wayne County at the moment. But I can get that information and get a better answer to the viewer.
We are actually going to be recording next week's show. These gentlemen are incredibly giving with their time, but I think they want to spend the Christmas holiday with their families. So we are going to record the show, so we will try to get that answer, and hopefully we can bring it back on next week's show. If you have a question that you want the doctors to try to answer, you can send us an email during this weekend, wctv@iue.edu, and we will try to get it on next week's show. Next question. Is there any plan for helping to slow the spread in our local elderly nursing facilities? Do you know if our problem locally is worse than other counties in the state? I turn to Dr. Jetmore to say.
Well, the plans we've had to stop the spread of COVID in the nursing home has been to limit visiting. In the summer, we had people weren't even able to come into inside, but they could visit socially distanced wearing masks outside. Since the cold weather's come, we've had to abandon that, but people aren't visited in their rooms. They're visited in an open area, one visitor per resident, wearing masks, being socially distanced. I think the problem, there's not been a single long-term care facility in this county that has not had a case of COVID. And 60% of the deaths that we've suffered in Wayne County have been people in long-term care facilities. So this is a real problem here in Wayne County because these are the most vulnerable people to COVID, the ones having the greatest likelihood of dying from the disease. But this, in answer to the second part of the question, this is a problem all over the state of Indiana, and in any state in the United States where there are long-term care facilities, they battle these same problems.
Okay. By the way, I've been told 39 weeks we've been doing this.
Okay.
Next question. Will the vaccine help those currently infected with COVID-19? What are the most current and effective medications for those with the virus?
Two questions in there. The first question is that the vaccine will help those currently infected with COVID-19. However, we do wait to give the vaccine until people are recovered from acute infection. But there is a little bit of a misconception out there. Some people have gotten the idea that you shouldn't take it within 90 days of having the virus, and that is not true. We just want you to be recovered from the acute infection. So basically, anytime after about 10 or 14 days from the start of infection should be adequate. Then it's fine to take the vaccine. Now, obviously, people who have had COVID-19 recently can and do develop antibodies, but we think that the level of protective antibodies is quite variable, and that we can achieve higher, more consistent antibody levels with the vaccination. So people who've had COVID-19 are not barred from getting vaccinated. We want them to when the time is right for them, and we're focusing on healthcare workers at the moment. The other question in there was about medications for COVID-19. Well, the only approved like prescription type medication treatment really involves patients who are hospitalized with COVID-19 and meet certain parameters. Then we're using quite a bit of remdesivir, which is an antiviral drug, which does seem to make some improvement with people who are very sick. And also using dexamethasone, which probably actually is more effective at reducing some of the severity of symptoms in hospitalized patients than the remdesivir, but we'll use combinations very commonly. And then some other things are also done, like Billy mentioned the convalescent plasma, use that quite a bit. There is also, for patients who meet certain qualifications, like maybe they're elderly or they have other risk factors for severe COVID-19 disease, but they're not in the hospital currently, but they are having symptoms, they can qualify for monoclonal antibody therapy. And this would be a treatment that's kind of similar in object to the convalescent plasma strategy, but basically the monoclonal antibody is a synthetically manufactured neutralizing antibody that has been given emergency use authorization for use in people with certain qualifying parameters, one of which is that they're not in the hospital. So the idea is that there's some evidence that by doing that at the right time, you may actually be able to reduce the risk for hospitalization quite a bit, actually. And so we actually have two sites where we're doing the monoclonal antibodies, one here and one in Fayette County every day, and we're trying to get more people for that. We think that a lot more people can qualify than are making use of it, and so we're trying to figure out how to make that more available. Then you devolve down to, are there other things that people can take if they have COVID-19 and want to be proactive in some way? There really aren't any scientifically proven strategies. I mean, there's no antiviral to take as an outpatient. There's nothing corollary to, say, influenza, where we take Tamiflu, typically. There's nothing corollary like that for COVID-19. But a lot of people do take, vitamins. Of particular popularity are vitamins D, C, B, and also zinc. And some people also take the over-the-counter form of Pepcid. That's the generic name is famotidine. And that is a type of, it's called an H2 blocker. We've been used to using it forever for stomach acid suppression. Nobody knows why that should have any impact, but there were some associational studies early on where there seemed to be an association between lower severity disease and people who were on Pepsid. That is super weak evidence. It's not by no means proven, but like the vitamins, which also don't have much scientific basis, they're low risk and inexpensive. And so if you want to do something proactive, those things are what a lot of people do. But I will not sit here and tell you that I guarantee that they'll make any difference at all, because there's very little good science behind any of that.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, being made possible this week by some support from the Wayne County government as well as the City of Richmond. Our next question for the doctors. I've had a reaction to the shingles vaccine. I had a fever, chills, and achy. Do you know if I will be able to receive the vaccine when it's available? I'm 64 years old.
Well, I'm with you. I'm not quite 64. I'm just a little bit behind that. But I had the exact same symptoms to the shingles vaccine, and and I have weathered the COVID-19 vaccine perfectly well. So we do not regard that level of reactivity to any vaccine as a bar to getting the COVID-19 vaccine. The situation that we're really concerned about is anaphylaxis, which is very different from what was described there. Anaphylaxis is an allergic reaction, but it involves swelling and closing up of the breathing tube, and also problems with the changes in the cardiovascular system, where the blood pressure gets very low, and people are very, very ill very quickly when you get anaphylaxis. So that's a very different thing from what the questioner described. So we have to draw that distinction. But even people who've had anaphylaxis with a previous vaccine or a previous injectable medication, they can still get the COVID-19 vaccine. It's just that we have to be monitored for longer, and we have to have EpiPens and such like on site, which we do anyway. So we are very familiar with what to do in that situation, because that's really a risk that can come out of the blue for anybody. And so we're always prepared for that. But there is a special alert about anaphylaxis in COVID-19 vaccine, because there were a few people in England who developed it, and now I think we have 2 people in Alaska. Why both are in Alaska, I don't know, but there are 2 people in Alaska that developed it this week. So that is something we're on the alert for.
What is the standard? You mentioned needing to watch out for people a little bit longer. What is the standard time if somebody gets the shot? I mean, I've gotten the flu shot, walk into a place, get the flu shot, turn around, walk out.
Yeah.
That's not the case with this vaccine, correct?
15 minutes is usually the traditional amount of time that you wait after getting any kind of an injection. And but for somebody with a history like that, we would probably have them wait for half an hour.
Exactly. That is the recommendation now. The standard observation time is 15 minutes. That's actually a requirement under the emergency use authorization. And since these anaphylaxis things came up, the FDA added that people who've had anaphylactic reactions previously should be monitored for 30 minutes.
Okay. We're going to keep going. We've gotten a few more questions in. Let's see if we can get a few more taken care of. If someone has had COVID-19, do they have to wait a certain amount of time before they get the vaccine? I think we hit on this slightly before, but
so but it bears repeating because the whole subject is confusing. So I don't mind answering it again. We don't want you to take it while you're actively sick with COVID-19, but any time after recovery, and basically that's within about 10 days.
And you want to reemphasize that you do not have to wait 90 days.
Correct.
Because I've heard that several places. That's erroneous.
Okay. And you both, and here's a question I want to ask real quick before we go back to the viewers' questions. You mentioned you got 900 doses of the vaccine in.
Right.
You've each had a shot last night. There were some shots being given today. How soon, because with this particular vaccine, there's a second shot. What's the time frame that you all have to wait to get that second dose?
21 days, almost exactly. There's a little bit of leeway around that, but not much. Yesterday we received 195 vials. The vials were approved for 5 doses per vial, but there's actually a realization that out of most vials you should actually be able to get a 6th dose. So the FDA has added that you can draw up a 6th dose. And that's what we're finding so far today, by the way, that we are able to get 6 doses out of each vial. But when you multiply 6 by 195, it comes to 1,170 is the number, I think. And so that's about how many doses we think we'll be able to do until we get our next supply, which will be about December 28th.
And when you get that supply, that will be held for the second shots for everyone, or how does that work?
We will continue to administer first doses. The first people to come back for the second shots will be 21 days from today, well, really from yesterday, because Dr. Jetmore and I had it yesterday. That's about January the 7th, roughly. And so we will continue to use the supply as we get it. The state has said that when we need the additional supply for the second shots, we will have it.
Okay. You're watching Ask the Doctors. What are your questions? Send them on Facebook or on Twitter. Once vaccinated, are you still supposed to wear masks, social distance, and frequently do hand washing?
Well, yes.
There was a hesitation there.
There's several, I was thinking I was getting ready to answer this. One of the things is that you know how disconcerting it is to you, it certainly is to me, and I assume it is for the two of you, to go into a store and there's somebody wandering around with no mask on. So that's one of the reasons to wear a mask, is so that you don't drive people crazy. Here in the early days of the vaccine, I'm talking about early days here. And the other thing that someone pointed out, or has been pointed out, is that the vaccine, the endpoint of the vaccine trials was people were looking to see when someone became ill with the symptoms of COVID, and then they were tested. The whole cohort wasn't tested. In other words, it's unlikely, but still unproven, whether or not someone could, some of those people may have gotten the disease and been a silent carrier and could spread the disease that way. So it still would be prudent, even after getting the injection, to wear your mask and socially distance.
We have to remember that we've learned to our pain, painfully so, that a lot of people can carry COVID-19 and spread it asymptomatically. And so that is one of the things, that's a great example of why this vaccine is safe enough to be used, but there are still unanswered questions about it that the FDA needs to provide full FDA approval. And this is a great example of that. We know the disease is commonly spread asymptomatically. So these people get vaccinated. Are they completely protected from getting COVID-19 at all? Or are some of them simply kind of ratcheted down so that they're rendered to be more in this category of people who can get it, but they tend to be asymptomatic and therefore can still spread? We don't know for sure.
There's so many things we don't know. I was asked last night, Tom, and you may have been asked this question by the people there, which was, how long will you be resistant to COVID-19 after having been vaccinated? Mm-hmm. Well, the answer is we don't know. It still remains to be answered whether or not we'll have to get this vaccine annually, whether the protection will wear off after 4 or 5 months. There is there is evidence of some heartening evidence from people that have had SARS, some of them 17 years ago, those people still have antibodies against that disease, and that's a coronavirus like COVID-19. So, but the answer is we don't know.
We've got 6 minutes left to go, later than we normally are. We're going to ask you to kind of update us on where we are from a number standpoint. That's a point
hang
that
on,
people
we're going to
always
move
want.
fast. As soon as Ryan can show that. This is the Wayne County data updated through yesterday, December the 17th. So far this week, the county's had 334 lab positive cases. There might have been some clinical positives, I don't know, but there aren't very many. That should project to this week ending about 467, 465, 470 total cases. But
Quick question on that, and I have last week's numbers. We are 2 off. Last week we were at 332. This week we're at 334. Last week your projection was for 581, and we ended up pretty close to that. This week you're projecting less. Why is that? What are we seeing?
That's just simply a mathematical projection. 334 cases over 5 reporting days, projected out to 7 days. You can do the math yourself. It's 467.6 or some such like that. So it's just a simple mathematical calculation, but you asked a very good question, because how certain am I of that? Well, not very. I think it's a good ballpark number possibly, but it could be more, it could be less, and it just depends on how many new cases they've identified today and will tomorrow, because those are the 2 days that are missing from the data. Okay. The next one, Ryan, is these are the age groupings, and I will just point out that for the last month at least, we've had typically about 19% of the new cases, lab positive cases, are over the age of 70, and those are the ones we're worried about for the risk of severe consequences, which is the third page. The deaths, if you just simply do the math, with what we know about case fatality rates, at least the last time I calculated them, we should expect from October 1st about 138 deaths, unfortunately. Now the good news is so far we've only had 110. And I don't like any of those deaths, but I think if we consistently come in less than what the state average is for those age groups, that means we're doing a better than average job of avoiding the disease and managing the cases. The last page is the READ statistics, which you can see that we've recently come off a high, and where we were at the high, we were basically double the numbers that we had in the spring, and now we're down to the high that we had in the spring. So we still have quite a bit of COVID in the building, but we've been able to pare back the use of our overflow beds, and there are still a few being used, but not as many. We feel better about it. And as I was talking to Dr. Jetmore before we went live on the air, the question is, should we breathe a sigh of relief that we're coming off a high, that things are getting better? I don't think so. I think, what we know about these kinds of diseases, it was certainly true with the Spanish flu of 1918. You go back and look at that, it wasn't 1918. It lasted into 1920 and 21 with a succession of waves of outbreaks that were, in many cases, worse than the last. That's how you get to 50 million deaths from the Spanish flu epidemic. We could be on that track if we don't do something different now. So the point is, we're coming off a high now, but we can expect more waves. We can expect another wave. Question is, how will we utilize this time between now and the next wave? And I think we have to talk about how do we get people back on track with transmission-based precautions. That's masking and distancing and hygiene. And then also get as many people as we possibly can vaccinated as quickly as we can, and making use of things like the monoclonal antibody, and just preparing ourselves for the next wave.
Dr. Jetmore, we have a minute and a half left. I'm going to give you 30 seconds of it. We are heading into the last weekend before Christmas. From a public health standpoint, what do you want the community to know?
Well, we, as Dr. Huth so rightly said, we're in the dead of winter. so we're all inside. It's cold out. And we've got these two very popular holidays coming up, particularly Christmas, and then followed up with New Year's. And these are times when people gather. Often they're drinking eggnog with a little whiskey in it, and wine on New Year's, and where they're not wearing masks. And this year, we need to make this sacrifice and avoid those occasions, because the positivity rate here in Indiana and in Wayne County is incredibly high. If you drive around or go around, you're seeing somebody that has COVID. I mean, that's how high the incidence of this disease is. We can see a light at the end of the tunnel, Eric, but it's a long tunnel. And this didn't suddenly come up, and it won't suddenly go down.
Okay. Gentlemen, I will see you all on Monday. If you have a question for Ask the Doctors next week, send us an email this weekend to wctv@iue.edu. Thank you very much for watching this week's Ask the Doctors. As always, I wish you well. Be safe. This week's Ask the Doctors has been made possible through the support of Wayne County government and the City of Richmond.
From the Richmond Code Enforcement Department.
On behalf of the Richmond Police Department.
On behalf of the Richmond Street Department.
From everyone at Roseview Transit.
From the Finance Department.
From the Office of Human Resources.
From the Richmond Sanitary District.
From the Parks and Recreation Department.
From the Law Department.
And the Information Technology Department.
From the Department of Infrastructure and Development, City Planning, and the Richmond Municipal Airport.
On behalf of everyone from the Richmond Fire Department.
From all of us here at the City of Richmond to you and your family, we wish you a very Merry Christmas and a happy and safe New Year. Stay strong, Richmond.
Your friends in Wayne County government hope you have a happy and safe holiday. They hope you will keep your gatherings to immediate household members. But whatever you choose to do, please follow all local public health guidelines, including proper hand washing, social distancing, and minimally wear your mask. A box of 50 masks will be available at a drive-through mask giveaway in Glen Miller Park on Saturday, December 19th from noon to 3 p.m. Enter the park at the main entrance next to the Madonna of the Trail or on Elks Road.